Sorry,
Good.
good evening for you.
Dress up and put my jacket on if you want.
Sure, no problem at all.
That's okay.
Yeah, that's absolutely fine. Just feel, I just want you to feel comfortable and nice. So that's fine, absolutely.
Where are you?
We are in Poland.
In Poland. Okay.
Yes,
In
yes.
what?
Yeah.
Okay. Okay. Good.
All right. Good day, Professor Doherty. Once again, I'm very happy that you joined us today to answer some more questions that we actually have. One of the last big announcements around the COVID-19 was that Russia a few weeks ago invented and registered the first vaccine in the world against this virus. And experts from different countries state that there is no scientific information on this vaccine. Actually, nobody knows what this vaccine is. So, Professor Doherty, could you please share your opinion or your vision on that? What do you think?
I'll tell you what I think I know, but there hasn't been a lot of information out there. My understanding is that it's a fairly standard vaccine product. It's there are two modified adenovirus vectors. These are adenoviruses, humans adenoviruses. These are viruses that normally cause common colds in humans. There are about 100 viruses that do that, and some of them are adenoviruses. Now, these viruses have been modified, so they're not what we call replication competent. That is, they can't make new virus, and you have to grow them in what's called a packaging line. And so that's a cell line that's developed that has bits of the virus in it that allows the virus to multiply, and you can get new progeny virus, which nonetheless go through what's called a one-step growth cycle. That is, when we're vaccinated with them, they get into our cells, they don't replicate, but they make new protein, and the new protein is the vaccine. So we're the factory that makes the vaccine. You don't have to make the new protein, the coronavirus protein, in a flask or something. You can make it in us. So what you do is you pop a bit of the coronavirus nucleic acid into the adenovirus vector, and it then carries it, and that's the vaccine. So it's the adenovirus spike protein, as far as I know. And as far as I know, the two viruses they're using are what we call Ad26 and Ad5. And they're going to give one virus, and then they're going to wait a while until there's an immune response developed, and then they're going to boost that with the other virus. So the two things these have in common are the coronavirus spike protein. They're two different adenoviruses, so we won't get what we call cross-neutralization between them, but we will have in common the coronavirus spike protein, which is the response we want to make. And my understanding, just from media reports, is that they make good antibody responses when you do this, and a reasonable cell-mediated response, a T-cell response, which is another part of the response. Not really the immediate vaccine response, but if we prime that up, it could help if we get infected to recover. So the vaccine strategy sounds perfectly normal, perfectly straightforward. I read somewhere that there's a lineage that traces it back, to some extent at least, to a vaccine the Chinese are making, but we don't know any more about that either. And I also read somewhere that it's being tested in Venezuela, and that it must have been a TASS website, I think, that other countries in the old Soviet Union are also signing on to receive this vaccine. So it sounds a perfectly good vaccine to me, but like all the vaccines, we haven't seen any results yet from what happens when you vaccinate people and you put them out there and they get infected. So we've seen earlier results for a lot of the other vaccines, the ones that are being developed in England or America, of what we call phase 1 clinical trials in humans and preclinical trials in lab animals, showing that they work in animals and they develop a decent immune response in humans. But we haven't seen that for the Russian vaccine. I'd expect it works fine. But the discussion around it is that though there's a mention of what we call a phase 3 clinical trial, which is a big trial in humans in Venezuela, the discussion has been around the fact that the Russians intend to just go straight ahead and give it to a lot of people in Russia. So we're all waiting with interest to see what happens. They may win the race insofar as there is a race. There's not really a race. We just want to get vaccines and out there into people. Russian virologists are very good. They've got a long reputation of excellence. So I think they certainly know what they're doing. And I expect the Russian Public Health Service can monitor very well what's happening with the vaccine. So they may not be calling it a phase 3 trial in Russia. That may be effectively what it is, because they'll be testing lots of people who've been vaccinated and then exposed in a context where they might get infected. So that's what I know about it. And I don't know how true any of that is, but that's what I've gathered.
All right. Are there any contraindications to vaccination in general, if there are? And what side effects might appear after vaccination? Because as we just figured out that basically phase 3 was not done yet with the Russian vaccine. And how should we know that it is safe to vaccinate people if there are going to be any mass vaccinations?
Yes, there are two concerns about these vaccines, and the adenovirus strategy is a well-tested one, and we think it's going to be pretty safe. So I'm not worried about the vaccine itself causing a problem when it's injected. It's not that different from the Jenner Institute vaccine, for instance, which uses a chimp adenovirus, or from one that Dan Baruch has been testing in the United States, which uses adenovirus 5 as a vector, which is, again, one of the ones that I understand is in the Russian vaccine. So I'm not worried about that aspect of it. What worries us not what worries us, but what we're watching for with all these coronavirus vaccines is the possibility of the vaccine in some people possibly making the infection worse. And the reason we're worried about that is there were some tests done with the original SARS coronavirus, the one that circulated in 2002, 2003 in Asia, that were done in monkeys and showed what we called immunopathology and suggested that in some monkeys, the disease looked worse. Now, a number of the vaccines have been tested in monkeys, and we haven't seen that for this second coronavirus, the COVID-19 one. And it looks okay. It looks okay in other animals as well. We think the problem with the original one, the original SARS, may have been the way the vaccine was formulated. But none of the vaccines where we have any detailed results for SARS-CoV-2 have used that type of formulation. That's been avoided deliberately. But we still have to see what happens when people out in the environment, out in the community, are vaccinated and then infected. And that's what we're waiting for. Now, we do understand that the Chinese have been rolling out a vaccine, and we haven't heard any negatives from them, but we haven't heard anything else either. We've just heard they're using the vaccine. So they're not telling us. So we're all watching Russia with great interest. It will be an enormous experiment. We're very grateful for the Russian people. I think they're a good vaccine, and my bet it'll work perfectly fine, but we won't know until we see those results.
Mm-hmm. And another question I would like to discuss with you is about, is about vaccine, as we understood the topic. It was not researched yet. How does this vaccine affect the people of different age? So does it mean that for each age group, there should be a different variation of this vaccine?
We don't know that yet. We do know that elderly people who get infected and get sick are actually making very good immune responses. But we simply think that's because they don't control the infection as well as younger people. That's why they're getting sick. And because they're not controlling the infection as well, they're getting a lot more stimulation with what we call antigen, basically with products from the virus. And as a result, they're making a good immune response, but maybe they're making it a bit too late. We really need it there at the time that people get infected. That's why we do vaccination. So we don't know how well elderly people will respond to one of these vaccines. The Jenner Institute vaccine is being tested in school children. It's being tested in younger and adults, and it is being tested in some people over 70. So maybe that will give us our first test results. Most of the vaccines, though, are not being tested in elderly people at this stage, as I understand it. They probably should be, but they're not. So it could be that in elderly people, we'll need an extra shot of vaccine, or maybe we'll need a lot more product in the vaccine. We don't know, and we won't know until those tests are actually done. We haven't seen any phase 1 trials. There is the ones where you just immunize with the vaccine, so far as I'm aware, in elderly people.
Mm-hmm. Well, fantastic. It seems that's all for today that we would like to discuss with you, Professor Doherty. I would like to thank you once again for your time, for your opinion that you share with us on these questions. We'll keep in touch. Take care and have a nice day.
And you too. Have a nice evening.
Lovely. Thank you so much. Bye.